Do you have hip pain while running? I recently had a very interesting patient case that had 4 different red flags when I was talking to her that cued me into what her hip pain was, and I wanted to create this video to share it with you about what these 4 different signs were, and if you have those same signs, what you can do to treat your hip pain. So just to give you a little bit of context, the standard onboarding process for the patients that I treat is to have a discovery phone call with me so I learn a little bit about their situation before I actually get them into the clinic. So this patient situation is taking place over the phone, okay? So I'm having a phone call with this lady who is explaining how she had hip pain that developed about 2 to 3 weeks ago, okay? And one of the first things that she mentioned about her hip pain is that she can't find the muscles to stretch, okay? So she's having this hip pain, but she can't quite figure out where it is. She's tried this stretch, moving this way, moving that way, and stretching generally helps, but she's not really getting the spot, and she can feel that. She can tell that she's not really getting the spot, and she's looking for help to see what stretch she can do to get the area of her pain, okay? So with that, I'm starting to think, okay, a little bit of a diffuse, like ambiguous, hard to define hip pain, all right? I don't like the sound of that. And then this next one, she was having difficulty walking, and she was limping after she was running. So pain while running is one thing. Pain after a run is another thing. Pain that causes you to limp and have difficulty walking after a run is a whole nother thing. This is not a good sign. If you ever are having difficulty walking or limping after you go for one of your training runs, that's not a good sign. So with her difficulty finding the muscle to stretch and having walking and limping being a problem after she runs, one of the leading diagnoses that's in my head is a bone stress injury, okay? So bone stress injury is a broader category. It includes bone stress reactions and bone stress fractures, okay? Everyone knows stress fractures, but it actually exists under the umbrella of bone stress injury, okay? So with these 2 findings, I'm starting to get worried that maybe this lady actually has a stress fracture in her hip, and she doesn't know that. So I then talked her over the phone of a couple simple objective tests to help me clue in to think, does this person actually have a stress fracture or not? And the first test I had her do was stand on one leg and then also take pressure off. So I basically had her shift weight onto the affected leg and then lift up the other leg, okay? And kind of go into a single leg stance. And as she was doing that, I asked her a couple questions. First, how does it feel to shift weight onto that leg? And then also, when we're done with the test, how does it feel to shift weight off the leg? So she told me that when she was shifting weight onto her leg, she felt the moment of pain, but as she was standing on one leg, she had no pain. And then when she took pressure off the leg, she felt that moment of pain again, okay? A fleeting moment, but that was her pain, and it was produced by shifting weight on and then taking pressure off, okay? That is a sign of a femoral bone stress injury or a hip bone stress injury. Putting pressure on, stimulating symptoms, and then also uniquely taking pressure off, also stimulating symptoms, tells me that there's something about the compressive forces going through the leg that is stimulating this injured area, and that's what bones do, is they kind of absorb the compressive forces in the leg. So just based off of her saying that, I'm thinking this lady has a hip bone stress injury, but I had one more test for her that I kind of talked her through. So the classic test for ruling out a bone stress injury is to jump on one leg 30 times. If you could jump on one leg 30 times and you have no pain, it doesn't produce your pain, you likely do not have a bone stress injury, okay? Having pain with single leg jumping doesn't mean you have a bone stress injury. Not having pain with single leg jumping means you don't have a bone stress injury. So what I had her do was I told her over the phone, okay, now what I want you to do is jump 30 times on that left leg. Do you think you can do that? And she said, no way, not a chance. I bet I couldn't even do one. That's gonna hurt. So number 4 was apprehension to jump on one leg. She was fearful to jump on one leg. She said, no, there's no way. I think that's going to hurt. That doesn't necessarily mean that she has a bone stress injury, but it really, with all of these things put together, it really makes me think this lady probably does have a bone stress injury, and we need to rule out bone stress injury before I can actually see her in the clinic. So what I told this lady over the phone was, I need you to go get an MRI for your hip as soon as you possibly can, okay? An x-ray isn't gonna do it. You need to go get an MRI. That's how they're actually gonna be able to see if you have a bone stress injury, okay? And if you do, there's no need for PT right now. You're gonna need to rest the hip, okay? So she was understanding. She said, okay, I'll go to an ortho and then I'll go get an MRI. So fast forward a couple days, she goes and she gets an MRI, and the results confirm that she has a femoral neck bone stress injury, okay? She hadn't yet gotten contact from her doctor or the ordering physician about the results, but she was able to see it on her own. She sent me the results, and I told her, okay, obviously this is bad news, but I'm glad that we know, because all you need to do right now is go get on crutches, okay? So because of the location of her symptoms and because of the nature of it, I need her to take weight off of that leg and then basically wait until she has her consultation with the physician to see if she needs to stay on crutches. But taking weight off the leg is going to be the main thing to do. So that case went from 0 to 100 real fast, okay? Somebody calling with hip pain who can't really figure out what it is, all the way through some of these subjective signs and red flags, then getting an MRI leading to the result of having a confirmed femoral neck bone stress injury, and now she's on crutches. So that kind of a situation is really important to be sensitive to and to have on your radar of, hey, is my hip pain actually a bone stress injury? Because if we're not thinking about bone stress injuries, and I were to have gotten this patient in the clinic and I start doing a bunch of tests and I start having her do a bunch of exercises, I'm gonna make her hip much worse, to the point where it could even progress to even needing surgery if it's not treated appropriately. So getting the right person to talk to about your hip pain is really important. So if you're wondering you're wondering what's causing your hip pain and you have these signs, you likely are gonna need an MRI and to take some pressure off that leg and to not run and even minimize walking, okay? So if you found this video helpful, give it a like. If you have a question about this, put it in the comments. And if you know someone who's struggling with hip pain that kind of sounds similar to this, make sure you send this video over to them. Thanks for watching.